practice tummy time. When your baby's awake and active, if you're not carrying your baby so they can be looking around and practicing that head-neck strength, place your baby on their tummies, on the floor. You're watching them. You're supervising your baby, but allow them to practice lifting their head up, turning around. This is also normal human development. Shortly after learning to lift their head up, they'll start lifting their shoulders up. They'll start reaching for things. That's, again, good human development. In other words, we were not meant to be sitting in seats, infant seats, all day long. Not only does that create that potential for that flat spot in the back of your head, but also potentially it could delay their development. Certainly newborn babies at first do not have much head-neck control, but I do think it's important that you either, if you're not carrying your newborn baby so they can be starting to lift their head, that you do practice a little bit of tummy time initially. At first they may not lift their head much, but certainly within weeks they'll demonstrate more and more skills. Another question is the use of car seats. Certainly when you're driving with your baby in the car, you have to use your car seat in case you're in an accident, but babies were not meant to be sitting up right away. They do not have adequate head-neck control. Common sense dictates that the mother is in back seat watching her baby, so the car seat is facing toward the back, the mother is watching the baby. In case the baby's head were to fall down, the mother can reposition the head and maintain the airway. The father should be driving, the mother should be in the back seat watching her baby for the first many months of life until that baby has good head-neck control. A common question asked to me is, when can I take my baby out into the public? I think use a lot of common sense. You do not get cold germs by going outside, taking walks, getting around a little bit. Cold germs are spread by people. So if you take your baby out into a public place, I think it makes sense to have an infant carrier that is up close to you. If you have close friends who do want to hold your baby, they should use hand gels to kill the germs on their hands. And I would advise that they use a receiving blanket so that your baby is not up against their clothing. I do not know where their clothing has been. If you do go into a public place, I would be very protective of what your baby is exposed to or touches. Germs are on objects that other people have touched, such as the carts. So if you are not carrying your baby up against you, you can use your stroller, but be careful what your stroller gets up onto or exposed to, and certainly minimize getting in an area where there's a lot of people, particularly if they're coughing and sneezing.